I am Charles Evans, Chairman of the Cumberland County Board of Commissioners. I am joined today by public health and hospital officials as well as Fayetteville Mayor Mitch Colvin to caution our citizens not to let their guard down in the fight against COVID-19. I know you are tired of this coronavirus. We all are tired of it. Cumberland County is entering the 9th month of fighting COVID-19, and our lives are forever changed. We update the positive case counts daily on the county website. More than 120 county residents have died from this virus. Dr. Green is going to provide information on where we are today, and I want everyone to remember these cases are people. Our brothers, our sisters, our parents, grandparents, friends, and fellow citizens. We are 2 weeks from the Christmas holidays. This has been a tremendously stressful year, and families and friends will want to gather together, but this year must be different. We know the vaccine is on the way. There is a light at the end of the tunnel, but it is a long tunnel, and we must continue to listen to our health officials and follow their guidance. I'm talking to you, Cumberland County, and everyone else that's listening. There are actions you and I can take right now to help us win this battle against COVID-19, and together we can win this battle. Take personal responsibility right now. Wear a mask always when you are around people who do not live with you. Wait 6 feet apart. Give yourself room and some personal space. Wash your hands and wash them often. Use hand sanitizer if you don't have access to soap and water. The phased approach to vaccine distribution will ensure that those who need it the most will get it first. And the vaccine will be available to all who want it in time. When it is my time to take the COVID-19 vaccine, I will. And I encourage you to take it as well, to protect yourself, your family, and others. Mayor Mitch Colvin will now come forward. He will then be followed by our health director, Dr. Jennifer Green.
Thank you so much, Mr. Chairman, Chairman Evans. And first, before I give any remarks, I would like to certainly thank all of the members of our healthcare profession who are on the front lines each and every day, working to protect our citizens and to fight this deadly disease. You know, it's been a little over 9 months, as the chairman stated, that COVID entered into our community. And certainly it has been quite a ride. But today I will allow the medical professionals to talk to you about the things that you need to do to protect yourselves. But my message today is to the citizens of Fayetteville is to let you know that we're walking through this together. You know, in May, the city council reallocated existing community development funds and block grant dollars to help our small businesses by way of $10,000 grants to help them retain jobs. Our business community was dismantled with the presence of COVID and the closures that took place. And also in May, the city of Fayetteville added an additional $250,000 from the general fund to seed to help small business in an emergency recovery bridge loan. A total of 69 loans were made, and all of the funding from this fund were completely dispersed into our business community. The city received 2 allocations of CARES Act dollars in the amount of $902,000 and $943,000 in June and October, respectively. We placed another $465,000 to help city residents pay past due rent payments, utility payments, mortgage payments, in order to mitigate any homelessness or economic impact to our local families. Another $133,000 was allocated to a homelessness assistance program to help shelters and case managers to increase food capacities of food closets at shelters and to augment and mitigate homelessness in our community and to help the most vulnerable among us. So there are a number of things that we have done, but we want to reiterate to you today that there's more that the city will continue to do to walk with you as we walk through this challenge of COVID in our community. And as the health professionals talk to you today, it's very important that you hear this, that we do the things that we've heard them say we need to do. We have to wear these masks. We have to maintain distance from other people. We have to wash our hands continually. And we have to practice those things so that we can finally, once and for all, run this deadly pandemic out of our city and out of our community. Again, God bless you. And remember, we will get through this. Thank you.
Yesterday in Cumberland County, our number of positive COVID-19 cases rose to 10,630. We will add 100 new cases today. In the last 2 weeks, for every 100,000 residents, nearly 400 have tested positive. Over the last 2 weeks, the percentage of tests that return to us positive is 9.6%. We'd like to see that number closer to 5%. More than 120 Cumberland County residents have died of COVID-19. The North Carolina Department of Health and Human Services County Alert System places Cumberland County in the orange tier, indicating substantial community spread. As we move closer to the holiday season, today is the time for us to come together to slow the spread of COVID-19 in our community. Our public health staff, hospital, urgent care, and other local health providers have increased our testing capacity over the last several months in partnership with NCDHHS. There are more than 24 test sites in Cumberland County, many of them free, and our providers since mid-September have performed more than 5,000 tests weekly. As a safe and effective vaccine will become more widely available over the next several months, this is an exciting step. Vaccines are nearly 95% effective, and there have been no major safety concerns. Tomorrow, an independent advisory committee is meeting to review the vaccine testing data before issuing an emergency use authorization for the Pfizer vaccine. Next week, the same committee will meet to review the testing data for the Moderna vaccine. In Cumberland County, along with Cape Fear Valley Health System and the Health Department, we will receive our vaccinations, our dose vaccinations first for distribution to the public. We'll know more about how many doses the Cumberland County Health Department will receive in coming days. And in preparation for our COVID vaccine distribution, our teams have been working alongside Fort Bragg and our emergency management staff to make sure that we have the capacity and capability to receive, store, and vaccinate the public when vaccine becomes available. The State Health Department has a plan to roll out our vaccine to the public, beginning with those that are the most at risk first. It's critical for our hospital staff who are caring for COVID-19 patients and our public health staff who will be staffing our mass dispensing sites to get vaccinated first. There have been others that have been prioritized, including those that are working in our homeless shelters, those that have been working in our congregate living settings, those that are working in our jail, and those that are living in those settings too. I encourage you to visit the State Health Department website for more information about how these individuals are prioritized. In addition, through a partnership with the federal government, CVS, and Walgreens, our long-term care staff and residents are also being prioritized to receive vaccine first. We hope that by early 2021, we will be able to vaccinate more widely in the public. I encourage you to visit and stay tuned to the Cumberland County Health Department website for more information about vaccination clinics. As we move closer to having a vaccine available to the public, I want to remind you and urge you to do a few things for me. We need you to work alongside our healthcare providers, our public health staff, our long-term care facility residents who are working on the front lines every day to fight this pandemic. We need your help. We need you to take personal responsibility to slow the spread of COVID-19 in Cumberland County. Wear your mask. The science is clear. Wearing a cloth face mask, when worn consistently and correctly, can decrease the spread of COVID-19. Masks are required when you're in indoor settings, regardless of social distancing, and outdoors when you are within 6 feet of one another. Wear your mask when you're around those that don't live in your household, even when you're with friends and loved ones. If you own a business or own a restaurant, help us by following the executive order requirements for wearing masks among your staff and encouraging customers to do the same. We need you to practice social distancing. Stay 6 feet apart from others when they're not in your household as much as possible. Limit the number of people that are in your social circle. Limit those interactions with those that are outside of your household. Even small gatherings carry a risk. Keep your public interactions to those that are mainly essential services: school, work, food, healthcare services. Continue to seek those. Support our local restaurants and our local business by eating outdoors, be socially distant, and getting curbside or carry out or shopping during hours that are less crowded. We know what works to slow the spread of COVID-19. We need your help to do it. I'd like to now introduce Mr. Michael Nagowski, Chief Executive Officer of Cape Fear Valley Health System.
I'm going to start out giving you some statistics. I promise there won't be a quiz at the end of this discussion, though. Right now, there are 60 patients at the Cape Fear Valley Medical Center who are hospitalized and are COVID positive. 60. The data is clear. Every month, almost every week, the number of positive hospitalized patients continues to rise. And I can tell you exactly when those inflection points have happened. It's been after every holiday. We hovered in the 20 range of the number of patients that were positive up until about July 4th. A week after that holiday, we jumped into the high 30s. It is not an accident that right now, after the Thanksgiving Day holiday, we've hit an all-time high of hospitalized patients, 60. And we expect that number to continue to grow, and we're, in all honesty, holding our breath for the Christmas holiday. In total, we have cared for over 1,250 COVID-positive patients who've been hospitalized at the Cape Fear Valley Medical Center. Make no mistake, this is a virus that impacts everyone. We have people that have been hospitalized from the age of 2 weeks to the age of 115. It also, from a mortality perspective, affects all age categories. While we've had no pediatric deaths so far, our youngest patient was 29 years old who died from this disease, and our oldest patient was 109 years old. To live to be 109 and to be dealt with this way by COVID is a tragedy, as it is for all of these patients. At the medical center and across the entire system, we've been dealing with this COVID situation on a daily basis. We've been meeting on a daily basis, almost on an hourly basis. All of the patients that are COVID positive at the medical center are isolated in specialized units. Or if they're in the ICU, they're in one section of the ICU. We have infectious disease doctors 24/7, either in-house or on call, all the time, nonstop. In our intensive care units, we have what are known as intensivists who also are available 24/7, caring for not just COVID patients, but the general population. I want you all to know we are deploying the latest treatments to help combat COVID-19. We assume that if you come to the hospital that you are COVID positive. We take no chances. If you are determined to be COVID positive, we immediately move you to one of our COVID units away from the general population. We have plenty of beds available. We have medical surgical beds available. We have ICU beds available. We have testing capability. We actually have testing capability in-house. The one thing that we are beginning to be concerned about is the number of staff that are available. What you are seeing on a national basis and across the state is hitting home here. And so the words that the chairman, the mayor, and Dr. Green all gave you are so very important. We have to remain diligent. COVID-19 fatigue is not an option for us. We are close. Next week, we anticipate that we will begin to distribute the vaccine. And we expect after next week, almost on a weekly basis, to receive additional shipments of the vaccine. Now, we all know we're not going to have enough vaccine to distribute 350 million people in this country and the billions across the world, but we will. We will get there. We have to remain diligent. And as the previous speakers have spoken, wear a mask. And I want to say this. I have heard, and I'm sure you've heard also, that people in the public don't want to wear masks or they're growing tired of wearing masks. If you encounter someone like that, please tell them. At the medical center, we have doctors and nurses and pharmacists who are wearing N95s for entire shifts, sometimes for entire days. All the while, they are taking care of the sickest patients. All the while, they're holding the hands of patients who are passing away. So please, I know it's not convenient, but wear a mask. If nurses can do that while working 24 hours straight, we can certainly do that. I will take the vaccine the moment it is available. I am 100% confident in it. I know it is more than 90, sometimes 95% effective. The FDA routinely approves vaccines that are only 50% effective. So the fact that our vaccines now are this effective is astonishing. And the fact that this country was able to do this in record time should be reassuring to the public. Technology continues to grow. Our ability to do things quicker today is better than it's ever been. And remember, we've had a framework to fight this and to develop a vaccine. SARS and MERS and Ebola, as deadly as they were, allowed us to develop the skills to develop this vaccine all the more quickly. Cape Fear Valley was very privileged. We were on the leading edge of phase 3 clinical trials to develop these vaccines. We as a health system, we as a team are very confident that it's going to be a solution. It's not going to happen overnight, but we will get there. Thank you very much for listening and for all of your assistance in fighting the vaccine.
So good afternoon. My name is Cheryl Bedno, Colonel Cheryl Bedno, Fort Bragg Department of Public Health. And really my comments are going to be brief because really they're very similar to what everybody has said so far. We need to work together to fight COVID-19 as a community. And for us on Fort Bragg, most of our staff, patients, and beneficiaries live in the community. So we are affected by everything else that we're seeing around us in the county and the state. So again, it's a community effort. I think we all started in March doing tabletop or practice exercises to prepare what we're going to do in the event of a pandemic. And throughout that time, since March, we have met together and looked at what we're doing and come up with those solutions that we can implement. So we've enjoyed a great working relationship, especially on contact tracing. And we continue to educate the soldiers, families, and staff about ways to prevent COVID-19, especially around holiday travel and holiday events. So I'm going to just mention again, because I think you've probably heard it 3 or 4 times, wear a face mask. This does work. Also, maintain that social distancing. I think we all want to come close and do things together, but we need to stay far apart. And also, wash your hands. Every opportunity for hand hygiene or washing your hands. And also, if somebody is ill, please stay home or seek medical care. And thank you.
I would like to thank you for joining us today and for helping us to get this important information to our citizens. Remember, wear a mask, stay 6 feet apart, and wash your hands. We are all in this together. Thank you. Good day.